Recently found COVID-19 variant has led to a number of countries barring travel from South Africa. The World Health Organization has classified the new variant as one of great concern. Joining me now to take a closer look is the Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Prof, a pleasure to have you on the program. Firstly, talk us through details of what health officials already know about this new variant. How does it differ from other variants?
Yes, good afternoon, and to the viewers. I think that information is constantly flowing in, sometimes in drips and drabs. But I think the meeting of the World Health Organization yesterday and the outcomes last night have sort of given us a summary of what we know so far. And I think that what we do know is that the variant has a lot more mutations than we have seen before. We know that it's got some mutations that we know that we have seen in previous variants like Delta, or mutations that we have seen in Beta as well. But it also has mutations that we have not seen. And I think the challenge here is that all indications suggest that it could be more transmissible. It could, to some extent, evade the immunity. And so it's been classified as a variant of concern. For now, we don't know what the combination of those mutations will mean for the behavior of the virus. And these are the areas that are currently under study, both looking at how it responds to antibodies and also how it responds to cellular immunity, as well as the extent to which it could be transmissible and how it may affect people clinically.
Let's expand on that. Currently, no unusual symptoms have been reported following infection with the new variant. As with other variants, some individuals are asymptomatic. What are the implications of this, and what does one need to keep in mind?
Yeah, I think that this is an important point, and it has a lot to do with we haven't really had enough time to observe the clinical features of people presenting with sort of the infection with Omicron. So if we were, for example, to just say that we knew about it for about a week now, only 1 week or less. So to be able to observe the full clinical picture, we need at least 2 weeks and perhaps up to 3 weeks to start to kind of paint a picture of what the symptoms would look like. And I think as this information comes through, we will know. At the same time, we don't necessarily know who is going to affect the most. Some information suggests that people presenting with this infection are mostly in the age group 18 to 34, but that does not necessarily mean that, you know, it's targeting these people in particular. It just means perhaps that's how the sort of clusters of outbreaks originated. So I can say in this area, in terms of the clinical features, we still have a lot more to learn.
While we do, as you rightfully say, have a lot to learn about this new variant, there are a lot of questions around the mutations and how this will affect vaccine effectiveness or disease severity, and also the level of transmissibility of this new variant or mutation of the COVID-19 virus. Is there anything else that you can add to this?
Not a lot more. I think that what's important to note is that when it comes to the effect on vaccines, we have to remember that it's incorrect to suggest that vaccines will not work at all. It's absolutely incorrect. And we have to understand that the immune system and the sort of immunity that is built after vaccination and even after infection, you know, it's a lot more complex than this virus can generally cope with. What we do understand is that the moment we see signs that there is some sort of reinfection of people who have previously recovered, then we have to worry that, you know, it may to some extent evade the immunity. And also if we find that there is infection or what we call breakthrough infections in people who are already fully vaccinated, then we have to pay attention, which is what is being studied. What we expect is that we may find that if a vaccine, for instance, has effectiveness of about 90%, this may be reduced to 80%. We saw this with Beta, but we don't know the extent to which it can be reduced. It might be 80%, it might be 70%, we don't know. And this is what we are studying. Just in terms of transmissibility as well, we also don't know yet the extent to which it is highly transmissible, especially when we compare it to Delta, because Delta was one of the most highly transmissible we have had so far. And that is also under study. For severity, as I indicated in Delta, we need a little bit more time to observe clinical progression of people who are presenting with infection with Omicron for us to be able to paint that picture. You may find that it's not necessarily clinically severe, but we need to make sure that transmissibility does not necessarily translate in overwhelmed healthcare systems if a lot more people are infected at the same time.
Now, when you look at the SARS-CoV-2, like all viruses, it changes with time, with mutations that afford the virus some kind of advantage being selected for in recent infections. Can we expect new variants to come and to also emerge wherever the virus is spreading?
Yeah, I think the lesson that we have learned so far, and I think we can all that ever since the beginning of the pandemic, we've been tracking mutations that we know they occur all the time, but not all of them are significant. Sometimes we see worrying in a variant, and we think that it will translate into a variant that is serious, and you find that after observation, it doesn't translate. And so some variants, even though they have potential, you find that they are not fit enough, so they are overwhelmed by other variants. So when Alpha came to South Africa, it didn't really take hold because it came around the time when Delta was also taking hold. So Delta was able to dominate. And again, we saw a variant C12 in South Africa. We don't know if this variant is going to take hold. At the moment, it looks like Omicron is the one that is taking hold. So we have to expect that we will see mutations, we will see variants, but not all of them are important.
Now, there is also the view of experts that vaccination remains critical to protect those in our communities who are at high risk of hospitalization or death, to reduce the strain on the health system and to also help slow down this transmission. What can you say to us in this regard?
Yeah, this is important. And that you may have observed over time that we moved from the nation of a lot on herd immunity and sort of preventing mild disease to more preventing severe disease and hospitalization and death. And this has a lot to do with the fact that if it's of antibodies going down, antibodies are just one part of one arm of the immune system. So antibodies are effective in neutralizing the infection at the point of contact as the infection enters the body. But then we also have the cellular immunity, what we call the T cells. That arm of the immunity essentially is quite effective at killing cells that are infected with the virus, which means that for someone who's infected, if that arm responds well, it can prevent severe disease. And when it prevents severe disease, it means then it can prevent hospitalization. It can prevent deterioration for people to go into ICU or death. So we want all those arms of the immune system to be activated. And if one kind of falters, then the other one is a backup. It is because of that backup that we often reiterate that we must acknowledge that immunity is more complex than we acknowledge, and in general, it is likely going to still protect us. And this is the part that often makes scientists say, do not underestimate the effect of vaccination and immunity, because that arm of the immunity can kick into place, and it often does.
Now, Prof, as we wrap up our conversation, what can you advise to the South African public to remain vigilant and continue to follow COVID-19 protocols?
Yeah, for me, I think that, this variant is a cause for concern for all of us, and everybody needs to pay attention. And I think that we need to stop the politicization of COVID-19 at this point. It's not going to work for us. We need to stop with the misinformation and conspiracy theories that are also not helping. They will result in people getting infected and people dying, and we cannot afford that. And people may not care in terms of how it may affect them or others, but in general, if we don't pay attention to this pandemic, this surge of infection can go out of control. So all the measures that we know that have worked for us before, we have to adhere to them. But most importantly, we're going to have a coordinated policy response, whether we are unhappy with government or scientists or the media or healthcare workers, we're going to need a coordinated response to get past this. And then when we get past it, we can then begin with our usual fights. But let's coordinate our response.
Well, there you've heard it. That was UKZN's Professor Mosa Moshabela, who has been unpacking the new COVID-19 variant for us, also urging there that South Africans should remain vigilant.